Why hey there, CPAP gentleman here, and the topic of this video is alternative therapies for sleep apnea. Dude, what is that on your face?
It's my dental appliance. I used it to treat my sleep apnea.
You probably noticed there's something different about me, something you haven't seen yet in any of my videos thus far. Here's a hint, it's right around this region. I decided to take the plunge and get myself a good old-fashioned set of braces, because you know, my teeth are crooked, misaligned, awkwardly positioned, really messed up. So that got me thinking, what else can you get from the dentist? Specifically, what else can you get that relates to the treatment of sleep apnea? This brings me to alternative therapy number 1, the oral appliance. Oral appliances, or mouthpieces, are dental devices that help keep your airway open at night, just like CPAP machines. How this is achieved, however, is a little bit different. The device maintains the airway's patency by positioning your jaw or tongue in a more forward position. This helps increase the pharyngeal space in the back of the throat, allowing you to breathe without obstruction during your sleep. Supposedly. Oral appliances unfortunately aren't an option for everyone, especially those with higher sleep apnea severities. Sometimes the mere act of repositioning things around isn't enough of a physical change to prevent complete airway closure. And of course, let's face the honest truth, it doesn't look as good as these babies. Alternative therapy number 2 is called nasal expiratory positive airway pressure, or nasal EPAP. It comes in the form of a disposable device placed on the nostrils that provides resistance to exhalation. This resistance provides a higher baseline pressure in your upper airway, a positive pressure that helps push everything open. Once again though, therapy through the use of these devices is not indicated in patients with severe sleep apnea. Studies show that there are little to no reduction in apneas when the condition's severity is high, and CPAP is still primarily favored in these cases. It's also worth mentioning that they don't work with mouth breathers. Alternative therapy number 3 is called upper airway muscle stimulation therapy. A large factor behind the blockage that occurs in obstructive sleep apnea involves muscle relaxation, particularly the relaxation of the tongue and nearby pharyngeal muscles. The therapy involves a device that is implanted underneath the skin in the upper chest region that stimulates what's called the hypoglossal nerve. This nerve plays a big part in the movement of your tongue. The device also has a sensor that detects your breathing patterns, so the nerve is stimulated when the airway is most likely to obstruct, usually during inhalation. Basically, the tongue contracts and gets out of the way, which relieves the obstruction. It's pretty simple to use too. You just turn it on before you go to bed, and turn it off in the morning. No fiddling around with masks or tubings. The procedure, however, is mildly invasive, and it's only effective for patients with obstructive sleep apnea. If you have mixed or central apneas, the stimulation therapy won't help you. Listen, I know CPAP therapy can sometimes suck, but it really is the most effective option. It tailors to lifestyle changes such as gaining or losing weight, or simply getting older. And through escalating therapies, can also treat more complicated types of sleep apnea. Ultimately, it's up to you and your sleep doctor to decide what therapy is best. But if you don't choose CPAP, we won't be able to hang out anymore. And I'll miss you. If you do decide to keep at it, stay tuned for more videos. Better yet, hit that subscribe button. That way I'll be able to keep telling everyone how awesome I am. Yeah, you know, this is actually pretty comfortable.
Custom.
Until next time, CPAP gentleman, out.